Good afternoon, LifeVantage. This is Darren Jensen. I'm the CEO and president of LifeVantage, and we're coming to you live from our media center here at our corporate headquarters in Salt Lake City, Utah. Thank you for joining us today. This is a continuation of our doctor series where we focus on specific products or a specific series of products and try to give you more information about those products. Before we begin, I just want to start out with a standard disclaimer that the statements that you might hear today have not been evaluated by the Food and Drug Administration. Any products that we talk about today are not intended to diagnose, treat, cure, or prevent disease. So with that in mind, I do want to welcome you all to our broadcast. Before we get started, as we do on most of our Facebook Live broadcasts, we're going to give away some product. Today, we're going to give away Physique Fat Burn. Trying to turn it the right direction here. I've got to do everything opposite. It's kind of a little odd. So we're going to give away Physique Fat Burn. We'll give away 3 of these. So when you join, if you could type in your name, city, and state, and then a couple of days from now, we'll do a drawing. So and we'll choose, several people to get some of the product. So name, city, and state. And it doesn't matter if you're watching it live or watching it later. We'll give it a few days before we do the drawing. So go in and post, and because we want to send you some free product. So today, let's get down to it. Today, we have with us Dr. Nancy Bryan. She lives in Arizona. A little bit about her. Let me go over her bio. She is a doctor of pharmacy, graduated from Ferris State University. She also has a bachelor's in biochemistry from Michigan State. She's a certified diabetic educator. She's a certified geriatric pharmacist, certified human and veterinarian pharmacist and formulator. She has a passion for helping people to be the CEO of their own body by understanding wellness from the inside out. She's married to John for 36 years with 3 adult children, 2 granddaughters, and 3 awesome dogs. And she also loves her Michigan State Spartans. So, Nancy, I want to welcome you on to our program today. Thanks for joining us.
Hi, Darren. Thank you so much for having me. I am absolutely thrilled to be part of this process because I do believe that these interviews are really, really helpful in getting our message across and helping people understand just how great these products are and what they can do for us. So thank you for having me.
It's my pleasure, and we're glad to have you on. And thank you for taking time out of your busy schedule. I know that you've been busy recently. We just spent some time together this weekend at the Pro 5 Summit up in Park City, Utah. So congratulations on qualifying for that.
Thank you. Oh my gosh, it was such a blast. Boy, everyone needs to get there. It is just unbelievable. Everyone told me it was going to be life-changing, and I think I doubted that a minute because I'm thinking, okay, I've met my husband and married him. That was life-changing. Had kids, loved that. But honestly, this is right up there in terms of really changing what happens in your life, and I'm so excited I was able to be there.
Wonderful. And we're glad that we had you there. And I think we had about 175 others, or I think other businesses that were there. And it was great to see everyone. Just some genuinely good people that are part of LifeVantage. So today, let's get started with our first question, because we have about a half an hour. And I love this format because it gives us some quality time to really delve in on a granular basis onto products and systems. And what I remember about our conversations at the Pro 5 Summit, Nancy, was you were very passionate about systems and that we need to use systems and not just individual products within LifeVantage. And I know one of these systems that you're passionate about is the Physique system. Can you, tell us why it's so important to use the system as a whole?
Okay, well, first of all, thank you so much. You're absolutely right. My passion has been for people to understand their bodies from way on the inside out. And I think once people start understanding things from that level, They'll start understanding that they have far more control of their health than they think they might. And so when I talk about systems, it has to do with all kinds of different systems that operate within our body to bring us all to wellness. And so with Physique, what I see in Physique is 4 products that have been put together for a purpose that work very synergistically together. And so what I wanted to be able to do was to talk about how by using those 4 products, they can make a big difference in our wellness. And when you have a difference in your wellness, you're automatically going to have a much better difference in your weight management ability. So for people that are really, really overweight, it gives them a chance to really work on several different areas instead of just thinking only about losing pounds.
I know with me, these last several months, I've been on a weight loss journey, and I know that for me, it was very important to use full systems of products, as well as to make other life changes. I mean, there wasn't any magic bullet, there just wasn't one magic bullet. I had to use a ton of magic bullets, to get to where I wanted to go. And it seemed as if they worked better when used together. I know that some people, when they're using our Physique line, may just use one piece of it. Maybe they're just using protein, or maybe they're just using the fat burn. I see that quite a bit, that people just use the fat burn. What would you suggest? I mean,
that is a great question. And it's a question I get a lot from customers and from patients when I'm talking to them in general about how they're going to utilize the Physique system. I think the most important thing to remember, just as you said, all of these things are tools. They're tools to help our body to do the work. And so what you want to take a look at is, of course, first of all, we have the protein shake, and I won't go into a lot of details on that in general right now. But basically, we want to be able to maintain lean muscle mass. That's going to be what helps to keep our bodies healthy in many ways, and it's what's going to help burn your calories. The second thing that we talk about a lot, and that what we need to start with, is the cleanse. And a lot of people don't begin to understand that the actual cleanse is really the foundation. It's the beginning of the whole system to our bodies being able to utilize and absorb nutrients and to utilize the foods that we put in it and to get rid of toxins. And so I really become very, I guess, almost distracted when I start talking about Physique, because I am so obsessed with people understanding how important the cleanse is. And then we have the importance of the probiotic. Without the proper probiotics through our whole digestive tract, we're not going to be able to break down foods and absorb those nutrients properly, and we're going to have toxins continue. And then,
Nancy, let me just go back for a second. Let me remind everybody. I'm over here watching the live comments go by, and I'm posting them up across the bottom here. But so if you have questions, post them up in the live comments, and I'd be happy to ask some of those questions to Nancy. But you said something there that I wanted to follow up on. So You're talking about the importance of the cleanse, that's the foundation. And of all of our products, to hear you as a doctor of pharmacy saying that that's the foundation, I hear very few people talking about the cleanse.
I'm so glad you're asking about it.
Yeah. So okay. When's the best time to use it? For how long? How should I be using that product to get maximum benefit? And why is it the foundation? I don't quite understand that myself.
That is a really great question. And I can tell you that many people think that the best thing they should do is just start on the fat burn. But when you understand how the cleanse works, then you'll understand how they all work together. First of all, with the cleanse, it has several ingredients in it that all work differently in cleaning out our digestive tract. And the main thing you want to think about is, if you have a clean digestive tract to begin with, right off the bat, you're going to have less bloating. So right away, you're going to feel a little bit better about yourself. You're going to start removing toxins. As you start removing some of those toxins, you're going to have more energy because your body's not fighting so hard to get rid of those. And they also have effects on us through our gut-brain connection. And so it's really important for us to understand that it's not just the digestive tract involved in gaining weight, it's our brain connecting to our gut. And when you have the cleanse, it's going to start allowing a lot of the communication again between your gut and your brain. And some of that has to do with when you feel that you're full after you eat a meal. Some of it's going to have to do with how your blood sugars are going to work. And so when you take a look at the ingredients in the cleanse, we have ginger root in there. The gingerols, which sounds like a drink, ginger goes through and really helps remove toxins and built up waste. That is so helpful because then it's going to allow the kidneys and the liver and the gallbladder to do more of the work they're supposed to on a every meal basis versus being so clogged up. Other things in there are going to be things like our fructooligosaccharides. I know that's a really huge word, but basically what it amounts to is undigestible carbohydrates. Those add healthy bacteria that are going to feed that probiotic that Dr. Rodarte talked about. That's really important for helping our whole digestive tract keep clean. And there's something called Chinese rhubarb. That helps with the rhythm of our digestive tract moving things. We have to have that movement. And of course, we have a little bit of buckthorn in there because we need to have a little bit of a mild laxative. And magnesium is going to be in there to help draw water in. So all of those things work together. And by cleaning out that digestive tract, we now have a place for those probiotics to go and to hang in there. And one thing I'd like to mention, Dr. Chevreau and I have had a lot of conversations lately about people having the need to maybe stay after they've gone on 2 capsules in the morning and 2 capsules in the evening for a week. That's how we're supposed to initially take it. That's bottles 28 capsules to take for a week. So you take 2 in the morning, 2 in the evening, make sure you have a full glass of water. But after that process of the system getting cleansed, there are several people that would probably benefit from staying on 1 capsule along with the probio. And the reason is that's going to continue to help with that healthy bacteria and feeding the probiotic. It's also going to help the body stay ahead of some of those toxins.
Okay. Well, you've now convinced me to be a lot more, consistent in my use of cleanse. So definitely would do that. And I interrupted you as you were going through. You just said that comment about the cleanse, and I wanted to delve into it. What's the next part that you wanted to focus on? I think you'd went on. I think you'd went on and started talking about the probio.
Okay. Well, the probio, as we know with the probiotics, what we see with the probiotics is, as Dr. Rodarte did so well on your other interview, was help us to explain it's so important to keep our gut from being leaky. It's going to keep inflammation down. All those good bacteria, when they get down into the digestive tract, they all have roles. Some of them are in the upper smaller intestine, some are down in the colon. And those bacteria all need to be there so that they can help us absorb nutrients and help to make certain vitamins. There's certain things that we actually make from our foods that you really can't get taking as a supplementation. And so the probiotic works synergistically by having a clean garage, if you will, to go live in. And that allows it to start making its home there and having those biomes that we need to have to continue with just having a healthy gut in general. That also is where you get the synthesis of things that are going to go communicate to the brain and to our pancreas. So that's why the probiotic is so important.
Now, with weight loss, I know, I've always been challenged with it throughout my life. Right now, I'm down 60 pounds. Yay. But I guess the true battle is keeping it off over time. What would you say, what's the biggest problem that most people face in weight loss? What's the greatest challenge?
Well, I can tell you as a pharmacist, there's lots of things people come into the pharmacy for, But one of the things that used to make me the most crazy was that people would always want to come in for diet pills. That was a really big thing that I really struggled with as a health professional, because I knew when they were coming in and asking for the products and looking for those over-the-counter things that they were all pretty dangerous, to be honest. And that scared me, especially because the people that were wanting to lose weight had high blood pressure, had heart problems, had diabetes, and they were wanting to feel better. And I could feel their pain and wanting to feel better. And the biggest struggle they had was they didn't feel well enough to go do the exercising. They had so much going on in their bodies, they didn't know how to diet. So they want this magic pill, and the pills can be really dangerous. And so one of the things that I really am so pleased with our physique system is that by using our fat burner, I feel very comfortable. This is a safe product. It contains ingredients that have been tested and that we know are not only proven, but safe. And that's really important, because when you're dealing with people that have a lot of health issues, we want to be sure that they don't have those kinds of struggles. I think the secondary thing that they really struggle with is just having a mindset. They think they're going to have to go starve themselves. And that's what a lot of people do. They'll go on a starvation diet. What they don't know is that may work for a few days, but then it starts signaling things, and your body literally starts saving things and fat because it goes into a starvation mode. It also is terrible on our muscles. We start literally eating ourselves. Our muscles start dissolving, and our muscles are the best way. That's why exercise is so important. Muscles are going to be the best way to burn our nutrients and our fats and all those sorts of things so that we utilize our whole system, as I talked about prior. And so that's why I get really, really excited about what we have in fat burn. And I don't think anybody comes close to understanding all of the ways that our fat burner works and why it's so special.
Well, tell us how it works. I mean, how does it work and why is it different?
Dr. Fifi did such a great job. I'm so thankful for her because of her research and her background. She knew scientists in France that were doing research on two specific ingredients that are in our products. One of them is Synitol and one of them is Fetol. And if it's okay with you, what I'd like to do is just kind of explain the difference between the two of them and what they do, because it's really the essence of why Fat Burner is such a unique product for helping someone as a tool to have better weight management. And that's what this is really about. This is a wellness journey. You said it yourself. This is a journey to help people to get where they need to go. And so, first of all, she knew about, in southern France, there were some scientists that were studying Synitol, which basically is a group of citrus extracts. So when you think about it, it's like sweet orange and blood orange and grapefruit and guarana. And what the studies showed her, what she saw in studies, was that it really helped with fat metabolism by removing a lot of toxins from the body. And when those toxins are purged out of our body, it gives our body a chance to start doing the things it's supposed to do again. So for instance, when you have your body full of fat cells, you can't, your whole system doesn't work right. The chemistry just starts falling apart, and you're not going to start absorbing things properly. So when you little by little can start literally having your fat cells purging toxins and getting rid of those sorts of things, you're going to start seeing the body operate better. And so that was exciting to me, because when they did the study, it showed in a 12-week study that was peer-reviewed. As a scientist, that's huge for me. That means that a bunch of scientists looked at this study and said, yeah, this is a good study. It was double-blind, which means the people in it didn't know what they were receiving. And it was placebo-controlled. So they had a placebo group and a group taking their product. And what they found was it was something like a 600% decrease in the fat content in these people over 12 weeks. That's just astronomical. And it was measured by, we all measure by weight. And I want to touch on that too, but they were measuring their hips and their waist, and they were able to see the circumferences really go down. It's not about pounds. It's about inches. It's about that fat way inside of us that we don't even see, that turn our bodies from being these nice, flat, svelte bodies to being round. And so that's something that's important. So that was one of the reasons.
Just one comment on that. You talk about that fat that's deep down inside. Is that visceral fat? Is that what it's called? And I think a lot of guys suffer from that. I know with me, you kind of get it right around the belly area, and you can feel your abdomen, and it's still hard, like you can still feel all the muscles, but the fat is underneath the muscles, around your organs. And I know that that's more dangerous, I think, than it being on the outside. How do we get rid of that visceral fat?
Well, and that's exactly what I'm talking about, because what happened is when she had those two products, when she had the Sinatrol and the Svetol, it helped fat metabolism in two different ways. The first one, what we just talked about with the Sinatrol, is through a means of increasing fat metabolism and purging toxins. The second product, the Svetol, to me was the more interesting one. And that was because it's from a green bean extract. And what it does is it really has a lot to do with our blood sugar. And all of this is linked to what we do with fat. So there's fat from just like excessive eating, but then there's also fat from when our bodies start not listening. And that's what happens in the digestive tract as we start getting older. You talked about the little paunchiness that guys get around their waist. And what happens is, over time, our insulin stops being sensitive to our foods when we eat. And when it stops being sensitive, then our body has things it doesn't know what to do with, so it starts storing as fat. Well, that Svetol, that's one of the things that it's been known to help with, is to help the insulin sensitivity, so that when we are communicating, our pancreas is going to talk better with our gut in terms of what it's going to do with food. And then the second thing that it does is it really helps to maintain normal blood levels after we eat. And it's those peaks of blood levels that are when we start putting fat into viscerals, because we got to be able to take care of excess glucose. We don't know what to do with it. Our body has to put it in a place because it's too dangerous for our brain. And so we start collecting fat around our organs. And that's why you've always heard of like fatty liver. That occurs from alcohol. That's a very specific kind of fat that will be created that goes around the liver because our body cannot keep up with getting rid of all of the toxins. And those two ingredients play a big part in our fat burner. And I think the most difficult thing for people is understanding, because they want to lose that weight right now. And this is about, back to the system and understanding it takes time for all of these things to start taking place.
All right. So let's say that I want to start the system. What would you recommend that I do before getting on a weight loss system? I know that they should always go talk to their doctor to make sure that they're in good health. Are there any medications that would have contraindications with our products? Anything that they should look out for?
Well, I always make a recommendation. I think it's always in everyone's best interest that if they're on medications, please let their physicians know that they are on these products. I don't expect that the doctor will applaud them. I don't expect that the doctors will have much comments on them, but it's really important because they need to know and understand that there's going to be some things out there that are really good tools to help their patient to have better wellness. And so when they know that they're on these products, sometimes they'll make a comment like, well, I don't know, you shouldn't be on any supplements with this medication. And so, you know what, you want to have a conversation, open conversation with your doctor so that they can understand what you're taking. And sometimes that's helpful if you can help bring them information. A lot of them are open to hearing that, and that's how they'll hear. The second thing is a lot of people, many people think they can't take the fat burner because I touched on the fact that there's grapefruit in it. And people need to know and understand that grapefruit can have a bad effect on people taking statins. And the reason is that there's an entity within it that creates that problem. And that is not in this product. So we don't have to have any issues with people worrying about taking the citrus extracts within this product, creating any problems with statin drugs or other drugs that are going to be metabolized through the liver. In fact, most of the time it enhances them. And in many cases, the reason it's most important for the physician to know is because many times they're going to need their medications reduced. They're going to start needing less of their blood pressure medication, and they might find themselves having certain things going on with them, like maybe get a touch dizzy, and maybe that's because they need their blood pressure reduced. So I always tell people, make sure the doctor's aware, because then they'll be able to say, hey, look, you are losing some weight. We better readjust your medications. But there is nothing in our products that's going to have an interaction other than being on Coumadin, which is a blood thinning medication, with all things, green foods, lettuce, vegetables, anything you eat with Coumadin, there's issues. And so you just have to work with your doctor. There's not an interaction per se, but as your body starts becoming healthier, those chemicals are not as necessary to do what they're being given for.
Well, Nancy, our time's starting to run down. Let me just ask one question. Looking at the totality of the system, because I know that you're passionate about systems, what sets the physique apart from other systems?
I think the overall process, that it is a system. It starts with the gut and the brain being able to communicate. It's going to help with your immune system. Your immune system is going to be better. When your immune system is better, you don't have inflammation in your digestive tract. And as a result of that, you're going to absorb nutrients much more efficiently and utilize them more efficiently. You're going to have a great capacity to see toxins removed. And when you see toxins being removed through fat cells, we're literally using our fat cells for energy now instead of taking it from our muscle. So instead of losing muscle, you're actually going to get lean body mass. And that, we see it over and over. Darren, you've seen it with the people that have gone through and been on these systems. They look younger because they're more fit, their muscle is there, and they look more defined. And overall health is going to improve. And ultimately, when your body is feeling better, you're going to feel like exercising, and you're going to feel like being out and about, and you're going to be proud of who you are, and it's going to show. And that's probably the most exciting thing for me about utilizing this as a whole system.
Well, very good. Well, Nancy, thank you for, again, taking time out of your busy schedule to share all this great information with everyone that's going to watch this interview. So thank you. And it's a pleasure having such highly educated experts like yourself as part of the company.
Thank you so much for giving us the opportunity. I can't thank you enough. Have a great day. And by the way, you look fantastic.
Oh, well, thank you. It's, when you were talking about that, people start to look younger and start to move more, and it's only 1:44 here, and I'm already about 16,000 paces for the day. I've already done a 10K, and you just feel like getting up and doing stuff. So I definitely was able to relate to what you're saying. Just one final thing for all those that are listening. Again, a reminder: put your name, your city and state down if you want to get into the drawing for this physique fat burn. And now I think I'm going to take this one home with me. I ran out, so I'm going to bring this one home.
Good idea.
And I got some different ones to everyone. But remember to put your name, city, and state down, as well as tomorrow we continue on with our leadership series. We're going to have Pro 8 Harvey Connor on, and we begin at 1:15 p.m. Mountain Time. So until tomorrow, thank you everyone for joining us. And again, thank you, Nancy, for sharing all this incredible information with us. All right. Have a good day, everybody. Bye.